We're going to get started here.
9:30 on the nose.
We can continue on that during health. Let's call the March 1st Health Committee meeting to order, 9:30 a.m. Start off with public comments. Is there any comments from the public? I don't see any reporting agencies either, so we'll go right into the ICPHD.
So again, good morning. At every health committee meeting, I've been giving you an updated grants and contracts list, and last month I didn't give you one because I told you that last month the only change on it was the vector control grant went from $14,111 to now $14,708. And that was because we had gotten, we had 2 human West Nile virus cases in our county last year during the summer months and fall months, during mosquito season. So that still is the only change that has been made to the grants and contracts list. So I didn't make a copy for anyone today. Typically we see grant applications starting to come in right about now for all these state grants. Typically they send them to us in late February and March, give us until April to fill them out. We send them in, usually by May we get a contract back from the state, and then in June all the signatures go forth and then it starts July 1, typically most of the contracts. I think we're going to have a big delay this year. Obviously we don't have a state budget, so they can't offer us allocation amounts for those grants until they know more about what the appropriations will be for those programs. So I think this year we're going to see some delays. I went to an administrators meeting in Springfield last week, and they strongly believe that, a lot of the state department heads were there, and they strongly believe that there will be some delays in getting those out this year. I don't know what's going to happen with that. A lot of health department administrators across the state are also concerned with signing contracts for services that we're not being paid for. And one of the biggest concerns is because, we talked about this at every meeting, the last few meetings, many of the health departments, at least over half of them, are now laying off staff. They're having furlough days. They're shortening their work week to 3 or 4 days a week. A lot of the health departments are really in a financial burden, because of no state payments. So they're concerned about signing these contracts if they don't have the staff to implement them, to meet those obligations or those grant deliverables in those contracts. So there may be just some delay because if health departments are not willing to sign those contracts, then the state may have to redo the contract. So there's a lot of issues going on right now with whether or not some health departments are going to be signing those contracts. I don't anticipate us in a situation where we have to lay off staff or shorten our work week. We're making other cuts. So hopefully, when those contracts come out, I'll be able to sign those and feel comfortable in knowing that we will have the staff and the resources to meet those grant requirements going forward. I can tell you that Michelle Gentry Wiseman, who is the Assistant Director of the Illinois Department of Public Health, got up in front of the entire group and said, we will hold harmless every health department who doesn't meet their grant deliverables because of staff layoffs. In other words, typically if you don't meet your grant deliverables 1 year, they cut your grant amounts for the next year, but the state is saying that they will not do that. So hopefully that's correct. So I passed out the program summary report to you. Just a couple little things to highlight on there. Under the environmental health portion of that summary report, you'll see that we had a lot of re-inspections for food establishments this year. or this month. 22 re-inspections is more than what we typically do in a month. We had set aside some time in February to go back to those places that had had issues, either a critical violation or a low score, to do some re-inspections. So that's why that number's a little bit higher. I anticipate that across the state, the number of re-inspections is really going to jump over the next few months. And the reason that that's going to happen is simply because a lot of health departments don't have the staff to go out and do the inspections, and so, or they're cutting down the number of inspections that they're doing, or they're saving on mileage, as they don't have funding to go out and have staff do this. A lot of these places know that, and so when they are inspected, they're not expecting someone to come, and then the score is lower, and you have to end up going back. So you end up, by not doing those inspections, you end up kind of shooting yourself in the foot because it causes you to have to go out and do more inspections. We had several complaints this month about, mostly about sewage. Most of our complaints were sewage. We had a few warm days where it warmed up outside, and you noticed if there's broken tile and sewage is coming up in someone's yard. So that happens when the weather gets nice. In the winter it's frozen and you don't see it. Under the community health portion of your summary report, we had a little increase this month again in chlamydia. We saw that in a couple months ago. We had like 8, just kind of 6, little run on that. The ptosis investigation is something that's not found in Iroquois County, or hasn't been found in Iroquois County to date. To my knowledge, according to all the records we looked back on, there have been no cases in Iroquois County. There are less than 50 cases, confirmed cases per year in the United States. It's a gram-negative bacteria. It's associated with a type of strain very close to chlamydia, although this one is found mostly in people who deal with birds. So it is can be a bird to human transmission. Usually those are your pet birds, your parakeets and macaws and cockatiels and those types of birds. But it can be found in turkey as well. So that case has gone from a classification, a state classification of suspect, to now a case classification of probable. But more laboratory diagnosis is going to have to be done to determine whether it's an actual case or not. We don't see measles very often in Iroquois County, and the measles case that we investigated there ended up being yesterday. We closed that case as not a case. The person had a high antibody level, but the additional laboratory showed that it was not a recent infection. They don't have an active case of measles. If you notice, our jail visits are down a little bit this month, which is a good thing. Just didn't have that many inmates that had to be seen. Under the senior services portion of your summary report, we have 7 open adult protective services cases, and those cases seem to be becoming more and more complicated. Those cases often involve financial exploitation of elderly. So it's very sad. I I also gave you another sheet that shows the Iroquois Memorial Hospital programs, the programs that we contacted them with, Family Case Management, and Healthy Families Illinois. The caseload for WIC, the assigned caseload is 557. You can see that their actual number is 430, so they're running about a 77% caseload, which is actually not too bad because the state average right now is running, the state average for WIC is at 72%. So they're doing okay. For Family Case Management, their assigned caseload is 182, and they have 188 Family Case Management clients. So they're running at a caseload of 103%. And then for Healthy Families Illinois, they have 31 assigned families, and they are now actually serving 32 families. So they're over 100% on that as well. And during the last meeting, I gave you a spreadsheet that showed where we were financially as far as the contracted services for WIC, HFI, and Family Case Management. I did meet with Chuck Bowman, the CEO of Iroquois Memorial Hospital, on February 11th, and the lead nurse, Leslie Cottrell, as well as Colin McCullough, who's running the program over there, let them know what my expectations were as far as capturing those grant amounts so that we don't end up paying them more than we're able to get back on those grants. They have some very specific plans in place to help capture that grant amount, money to help increase that WIC caseload so that we don't end up losing money at ICPHD for those programs. So they're aware of it, they know what my expectations are, and they're working towards it. And the numbers came in for the end of January. On the 15th of February, we sent in a new EDF, and those amounts were higher than they typically have been. So I was pleased to see that they're working on that. We had a WIC and Family Case Management audit yesterday, a fiscal audit here at ICPHD for those programs. She didn't indicate to me that she had found anything inappropriate. She was very pleased with our documentation and our paperwork and the supporting documentation that we had that went along with those monthly EDF showing what those expenditures were, and had scheduled 4 hours for the audit with us and was only here about half an hour. So I'm very pleased. Said that was very concise and we had everything ready to go for her, and so she was very happy with that. So we'll see when the actual audit report comes out. I'm not silly enough to think that we're not going to have something. They're going to find something. they almost have to find something. We have additional audits coming up, quite a few of them. Every program has their own fiscal audit. They have their own programmatic audit. Senior Services, the Title IV, the rest of it, mid-year review is scheduled for March 10th, so they'll be here then. Our Adult Protective Service review will be April 26th. The HFI site visit will be April 10th through the 12th, and yes, April 10th is a Sunday, and they are coming on a Sunday to review them at the hospital. So that first day they're just going to go over their policies and paperwork and procedures and look at their documentation and their plans. So I won't need to be there that day anyway. And then our Public Health Emergency Preparedness Audit is scheduled for April 28th. Obviously with the state budget impasse, we're not being paid for a lot of the money, but I will tell you this much. So to date, the state owes Iroquois County Public Health Department $222,000. The exact amount is $222,285.17. $92,000 of that amount is specifically for HFI. There is a legislative bill out there that is going to address that, hopefully. I don't know what will happen with that. But family case management, last month I told you the only one that was paying was WIC because it was federal. Now, family case management has also been court orders to pay. On February 9th, Judge Joan Humphrey Lefkin signed a court order ordering the state of Illinois to pay family case management providers by February 22nd. So on February 22nd, I got onto the DHS website. I can go to provider inquiries. There's a payment section I can click on. I can put in my PIN number from the health department, and I can see what has been appropriated out to us, what has been sent to the comptroller's office, whether it's been warranted and mailed by the comptroller's office. And as of yesterday, it was actually warranted out on the 22nd, and as of yesterday, it should be in the mail. We should have that today or tomorrow. That total amount that's owed to us is $39,286.03. So out of that $222,000, once we get that in, we can take that off there. So if, like I said, for healthy families, if they are court ordered to pay us that $92,000, that'll really take a big chunk of what the state owes us off of what we're being owed and help us out. So we'll see. The legislative bill that I spoke to you 2 months ago about for the local health protection grant has stalled. There's a legislative committee meeting. I'm part of that legislative committee for the state. We have a conference call next Monday. We'll see where that's going. They found senators and state representatives to sponsor the bill to pay the local health protection grant funding, which is pretty much your front door money for your health department. But we'll see whether that gets passed or not. Right now, it has stalled. It's just on the table, and they're not doing anything with it. We did have our new CDP billing program implemented. They came here and trained us on the 23rd. We got a state grant that paid for all the startup costs on that. And we were trained for that on February 23rd, and we actually went live the next day on February 24th. Unfortunately, we're still working on our intake forms and our contract with the insurance company. So even though we're live and able to bill, we don't have contracts completed with all of those places, and CDP is helping us with those contracts. But it's a lot to get contracts from insurance providers to let you bill them. So I have step-by-step processes where we are on all 7 different insurance companies that we started off with. So if you're interested in that, I'd be happy to share that information with you, but it's wait for me. Some other information, we were recertified. Our health department did receive 340B recertification with the state of Illinois. That certification allows us, if we have an outbreak, to access some state funding and get medicine at a reduced cost, which will really make a difference for us if we have a TB outbreak, because TB medicines can they're so expensive they can just wipe you out. So that will really help us. So we were recertified for that. And then on February 11th, we had a Zika virus meeting, informational meeting here at their several county board members did come. I was grateful for their attendance and their time. We went over exactly what Zika virus is and what we expect. It's a very mild disease. Obviously, we don't have any cases in Iroquois County. There aren't any mosquitoes outside right now. We'll see if this becomes a problem this summer or not. Only time will tell. So that's all the information that I have for you today. And if you have any questions for me, I'd be happy to answer those.
Anybody? Thank you.
Thank you.
Moving on, any old business to come before the committee? Any new business to come before the committee? I would entertain a motion to adjourn.
Second.
Dan? All in favor to adjourn, say aye.
Aye.
Opposed, same side.